Good afternoon, everyone. This is Christy Schellenberg from the National Alliance to End Homelessness, and we will start the diversion webinar, or the role of emergency shelter in diversion, in the next 1 to 2 minutes. Thank you for joining us today. Good afternoon, everyone. This is Christy Schellenberg from the National Alliance to End Homelessness, and you're with us this afternoon for the role of emergency shelter in diversion. Thanks so much for taking your time today. We really appreciate it. Just a couple of housekeeping notes before we begin on today's webinar. Please note that all the lines are on mute. If you'd like to pose some questions, you can do so at any time in the questions box, which you will find in the navigation bar on the GoToWebinar platform. It's under questions. We will try to get to as many questions as we can before the end of the webinar today. Please note that the webinar and the slides, in addition to some additional resources, will be posted following this presentation. And we hope that you'll share that information with your staff and any key stakeholders that you would like. I'd also like to let folks know there will be no certificates issued for this webinar today, so please note that as well. So I'd like to introduce our speakers today. I've introduced myself, Christy. I'd also like to introduce Cynthia Najendra. She is our director for the Center of Capacity Building here at the National Alliance. I'd also like to introduce Felicia Harrington with LAMP. She's going to speak with us today about her experience in implementing diversion strategies in the shelter. And last but not least is Kay Mosier-McDivitt. She is a Senior Technical Assistant Specialist here at the National Alliance. And Cynthia, I'd like to hand it off to you.
Thanks, Christy, and good afternoon, everybody. Welcome to another webinar in the Emergency Shelter Learning Series. So this webinar is one in the Emergency Shelter Learning Series that we've been having for the past year or so. And this series is primarily intended for shelter providers and for system leaders and funders that want to better understand how to integrate shelters into their system. The primary goals for the series in general are to help communities strengthen shelter policies and services to improve the housing outcomes for people experiencing homelessness across your entire system, to implement a system-wide approach to preventing and ending homelessness that includes emergency shelters, to align emergency shelters goals with the community's goals to prevent and end homelessness, and to provide low-barrier, safe, and housing-focused shelter. The series has a number of webinars and associated tools and guidance, and you can find this series at that website link there at the bottom of this slide. Next slide, please, Christy.
I think it did advance, Cynthia. Did it not advance for you?
It did. It hasn't advanced on the screen, but there we go. So the 5 key elements to effective emergency shelter practices are the following: having a housing-first approach, practicing safe and appropriate diversion, ensuring that your shelter provides immediate and low barrier access. And today we will be focusing on the safe and appropriate diversion, making sure your shelter is housing focused with rapid exits to housing services, and using your data to measure your shelter's effectiveness and make shelter design decisions. Feel free to download this infographic from the webinar on our website. Today, again, as I said, we will be really focusing on that second key to effective shelter, safe and appropriate diversion, particularly as it relates to emergency shelter practices and program design. So our agenda for the webinar today is the following. We're going to be talking about diversion, the who, what, the when, the why of diversion. And we're really focusing on identifying the role of shelter in diversion. We will be describing diversion strategies related to shelter practices, provide community examples of using diversion strategies in shelter, provide an overview of the fundamentals of effective diversion practices at shelter, and describe successful diversion outcomes. So while this webinar will discuss diversion strategies, we're very focused on diversion practice as it relates to shelter, rather than how it should be implemented across your entire homeless response system. The Alliance is developing much further guidance on this, on diversion for your entire system, and we'll be providing that in the coming months, so stay tuned. But we really are sort of intending this for the shelter providers and the funders and the system leaders that are really trying to think about how shelter and diversion relate to each other and how you can have successful diversion practices at the front door of shelter.
So Cynthia, just an FYI, the slides are just advancing a little slowly, but they are advancing.
Great, thank you. So to set the context for why diversion can play such an important role in a community's response to homelessness, let's briefly discuss the elements of an effective homeless response system, because I think that will sort of help locate why diversion is important and sort of how shelter fits into that picture. An effective homeless response system really aims to have to make homelessness rare, brief, and one time. It focuses on housing as the primary solution to homelessness. So every part of the system is really thinking about how are we going to rehouse someone or at least help them preserve the current housing they have. We want to make sure that every part of the system kind of understands where they are in that overall goal and what their role is in focusing on housing as that primary solution to homelessness. And the system should be helping people resolve their crisis at every engagement opportunity. And that's where diversion really comes into play. And we'll talk about that for the rest of the webinar in several ways. So we're trying as a system, as an overall homeless response system, to help people resolve their housing crisis wherever they present and at every opportunity that we have to engage them. The U.S. Interagency Council on Homelessness released a new federal strategic plan to prevent and end homelessness this year. If you haven't taken a look at it, it's called Home Together, and it is on the United States Interagency Council website. And there is some parts of it that talk about diversion in your system, and really the plan overall just defines what a successful system looks like. So a successful system that is preventing and ending homelessness does have the capacity to do these things. The system should quickly identify and engage people at risk of and experiencing homelessness, should intervene to prevent people from losing their housing and divert people from entering the homelessness services system, which we will be talking about today. Systems should provide people with immediate access to shelter and crisis services without barriers to entry if homelessness does indeed occur. And the system should quickly connect people experiencing homelessness to housing assistance and services tailored to their unique needs and strengths to help them achieve and maintain stable housing. Again, that plan is on the USICH website, and I definitely encourage folks to take a look at that if they haven't already read that. So now we're going to talk a little bit about what diversion is, when diversion should happen, and who should be diverted. We will be talking about the guidance that we have, the current guidance we have for shelters will play a role here. And as I said, again, we will be developing and sort of putting out further guidance, but this is just sort of an overview of the what, the who, the what, the when, and the why of diversion. So what is diversion? And I think, Christy, if you could just go back one slide, please. What is diversion? Diversion is a strategy that helps people identify and access alternatives to entering emergency shelter to resolve their immediate housing crisis and avoid homelessness. Diversion really is meant to be a service. So we don't want to think about diversion as a denial or a barrier to shelter entry. Instead, diversion should feel like a service to help people avoid a shelter stay and resolve their immediate housing crisis. It shouldn't be another barrier to entering shelter. Instead, you're expanding options for people to identify alternatives to shelter. We're providing a service that helps people find a better option. Shelter is kind of a last sort of resort option that we want for people. We don't want people to have to enter shelter if they have better options. And they might not be long-term options. They might not be options that are immediately obvious, but we want to sort of try to help people resolve their housing crisis without even having to come into shelter. And if that's possible, a person can be successfully diverted. So diversion can have sort of very different components depending on what it looks like at your shelter. And I think that the key here is to think about, it doesn't mean that you have to have all of these services at shelter and you have to have a lot of financial assistance at shelter. What has to happen is that services and the flexibility to provide financial assistance should be kind of considered when you're thinking about diversion. Target assistance may include a combination of all types of services and flexible financial assistance. It could be mediation, diversion, housing location, legal assistance, services, other supports. And many of them can be provided by public, nonprofit, faith-based, philanthropic programs within the community. It does not have to be provided by the shelter. But what the shelter is really doing is really starting to engage people before they come into shelter with a really creative problem-solving conversation to identify solutions to the immediate housing crisis that a person has. You're trying to connect people to family and natural supports, perhaps offer strengths-based case management. You might be offering conflict resolution or mediation or referring people to that sort of service. The same thing with housing search and placement and mediation with landlords. Maybe people just need to sort of have kind of resolve an immediate situation or a conflict that they're dealing with, and that would allow them to stay where they are or to kind of fix a relationship where they might be able to stay longer. And so you might be offering that at your shelter. Your staff might be doing that, or you might be connecting people to those kinds of services. Diversion can also be attached to flexible financial resources, but I want to just say that it doesn't have to be attached to financial resources. So if you're a shelter out there and you're thinking, well, we don't have financial resources to offer people, it's important to note that many communities tell us that financial assistance is not necessary to successfully divert people. It's very helpful. It can really kind of be a very cost-effective way to help resolve an immediate housing crisis. So it's important just to think about, do we provide some of these things already? Do we have things like ESG funding that could help us kind of cover some costs that would help keep people from having to enter shelter? And some of the financial assistance could cover things like utility arrears, moving costs, car repairs, rental subsidy or arrears, food assistance. But it should be flexible and it should be nimble. You want to be able to give it to someone immediately. But it's really about helping someone with their immediate crisis, just with a little bit of what they might need to stay at, say, their mom's house for a little while longer, or be able to pay some back rent. And that's the reason that they might be about to be evicted. So we want to think about how to target that assistance to prevent the housing crisis and prevent it from escalating further so that it doesn't result in homelessness. So when should the system use diversion strategies? Oh, I should say, an important thing is that services and financial assistance does not have to be provided by the shelter itself. Financial assistance is often unnecessary to successfully divert someone from shelter. So as I said before, you really don't have to provide things right at the shelter door. So when should the system use diversion strategies? This is an important question and we're talking about the system, not shelter. So when should the whole system use diversion strategies? The system should really trying to divert people whenever possible and when it is safe and when it is appropriate. So you can have diversion services at the access points, or we can call them front doors to the homeless system. That might be your coordinated entry system access points. So if you have physical locations, you might have a 211, you might have a hotline that people call. That can be a place where you can train diversion staff to have these kinds of conversations and offer these services. Certainly, you can have them sort of at emergency shelter, which is what we will spend the bulk of today on. And other places people are seeking homeless services and assistance. You might have other places in your community where people are coming, like your TANF office, or other places people are coming seeking homeless service assistance or having a housing crisis. And that might be the right place to have some of these diversion strategies in place. When should shelters use diversion strategies? Well, it's important, again, to think about the shelter's role in the system. So if people are coming to shelter and that's where you do your intake for shelter, the right place to have your diversion strategy is when the person is seeking shelter, but you would want to employ these strategies, have these conversations before shelter intake. So you don't want to enroll someone in shelter and then ask them what the alternatives are. Rather, you're beginning that conversation with everyone who is seeking shelter before you do any intake. Also, it's likely that you might not want to do any other kind of assessment, for example, a coordinated entry assessment or a VI SPDAD, until you have this diversion conversation, because it might not be necessary to go through that assessment process if they're not going to come into the homeless system. So it's important to kind of think of this as a really front door strategy, so before someone even has to enter the system. So who can be diverted from emergency shelter? Oh, I'm sorry, this slides are not catching up. Here we go. When shelters use diversion, they may want to think about how it is sort of distinguished from when prevention happens and when services are provided at shelter. So this chart shows the differences between traditional prevention, you can see there at the top left, at risk of losing housing, diversion, and kind of housing-focused rapid exit services that we talk about that you should employ when someone is already in shelter. So you can see there, the difference between prevention is that someone who needs prevention assistance is at risk of losing housing and precariously housed, but is not necessarily seeking shelter. So you might be having someone coming to you who needs eviction prevention help or something like that, but they're not seeking shelter necessarily. It's something kind of further upstream. Diversion should be employed when someone is knocking on the shelter door, really looking for a place to stay, looking for homeless services assistance. Once someone is literally homeless, which we will talk about in a minute, you weren't able to divert them, they're coming into your shelter or they're living outside, that's when you want to employ housing-focused and rapid exit services in shelter and think about how to match people to housing interventions. But if you look on the right here, the reason we say that services provided in the intervention kind of look the same across all of these interventions, what we're trying to say is that the services should really look the same no matter kind of where the person is. No matter where the person is kind of entering the system, you're really just trying to rehouse them. You're trying to give them creative problem-solving solutions. You're trying to attach them to the assistance they need. And diversion is really happening right before someone gets into shelter. So who can be diverted from emergency shelter? What we have heard communities tell us, and what we are seeing as being most effective, is to try diversion with everybody. Try having a problem-solving conversation with everyone seeking shelter to determine whether it is viable, whether it is desirable for that person. It's really we want to sort of really center this on client choice. But we want to make sure that it is also safe and it is appropriate to divert them. Safety and appropriate diversion, safety and a sort of an appropriate situation to divert them to is incredibly important. We don't want to send people back to places where they may be in a dangerous situation or they don't want to go back to. So we want to ask the kinds of questions that would really unearth that sort of situation. But we want to kind of see what their situation is and if they have alternatives. So who can emergency shelter think is not a good sort of candidate for diversion? If you have tried to have the diversion conversation and you find that individuals or families do not have any safe or viable alternatives aside from staying in shelter, then you have to consider enrolling them into shelter, and hopefully you have space. Again, safety is critical. You don't want to send someone back to a dangerous situation, so you want to try diversion first as a conversation or many conversations to figure out what the situation looks like for someone. But if there's no alternative, that's when you decide to enroll someone into shelter. So when diversion is not appropriate, when someone is enrolling into shelter because you sort of you weren't able to divert them for a number of reasons, maybe, the same diversion strategies, effective problem-solving conversations that are client-centered, focused on creative solutions, housing assistance, housing case management, housing-focused services, those should continue once the household is in the shelter in order to quickly resolve a household homelessness. You really want to keep trying to house that people. No, you can no longer divert them from homelessness or from a shelter entry, but you want to keep trying to house them. So the activities, sort of stay in that same level of urgency. How can we resolve this person's housing crisis? We couldn't divert them, but we're going to keep doing everything we can, deploy whatever services we have to keep trying to get them housed. These continued strategies that should be happening in shelter provide it's a critical housing-focused and rapid exit sort of focus for all households assessed for housing and support services. These are particularly critical for people who are never going to receive rapid rehousing or permanent supportive housing. We all know that there are people coming into our shelters that while they might have been assessed for coordinated entry and be prioritized for shelter, they may not be able to access those resources. So housing-focused rapid exit services in shelter are so important for the folks, especially the ones that aren't going to get those interventions. So we want to make sure that we're reaching all of those folks in shelter, still having those problem-solving conversations, still trying to find creative solutions to help people exit shelter to a more permanent housing situation. So why should we employ diversion strategies? Well, diversion really, as we've seen in communities across the country, are seeing a lot of success in helping their system create better system flow, and diversion is a big part of that. Communities that are employing diversion strategies are finding that it reduces new entries into homelessness, and this is important when you're sort of trying to, house folks as much as you can across your system. If there's a sort of huge inflow of people, if you can't kind of shut that faucet off or turn it down a little bit, that's going to make it much harder to kind of keep housing people at the rate you need to house them. So, diversion, if you're sort of helping people not have to come into homelessness, you're going to reduce new entries into homelessness. It cuts down on shelter waiting lists. So if you do have shelter wait lists, which we don't recommend, but we know many shelters do have them, if you're focusing on the people that may be trying to get in but have a place to stay, they might not need to be on your wait list if you're able to kind of resolve their immediate housing crisis. It also stems inflow, as I said, into the shelter system. It reduces the demand for limited shelter beds. So if you think about your shelter as sort of a very important resource that's high demand, if you are stemming the inflow of people coming in and you are really trying to reserve those beds for the people who really, really have no alternatives, you're able to do that better when you're diverting people at the very front door. You're also going to improve your system performance outcomes by reducing new entries and re-entries into homelessness, and you're going to be able to target more intensive homeless interventions and resources that you have at shelter and in your whole homeless system to be provided to those with the highest needs, the ones that have absolutely no alternatives to a shelter stay. So you're able to kind of keep those resources for the folks who really, really need them to exit, and then help people so that they don't have to come to the system with other resources. When we don't utilize diversion, what happens is that people enter shelter when they could have successfully been diverted. And I think we're going to hear a lot about that from our speaker today, Felicia, because what shelters are finding is that there are people who come to shelter, and a lot of shelters have kind of a first come, first serve entry policy. And if you come and there's a bed available, we're going to give it to you. But there are a lot of people in shelter who may have been able to be successfully diverted and to open that bed up for somebody else, allowing the shelter to serve more people. Shelters can become overloaded and cannot adequately respond to those who have no other safe alternative housing options if their shelter beds are already full. And often when your shelter beds are already full, there may be an increase of people who are unsheltered in your community because there's not enough capacity at your shelter. So what we're trying to do is create better flow through in your shelters by utilizing a way to keep people from not even having to enter and helping them get housed or stay housed without having to get those services in shelter. Really quickly, I want to touch on kind of where to begin with the homeless response system in terms of where does diversion fit with coordinated entry and where does diversion fit with shelter. And again, I'm going to very briefly touch on this. We will be doing further more in-depth content on this in the coming months, but I just wanted to briefly discuss. So how does diversion fit with coordinated entry systems and shelter entry? Many communities have not yet integrated shelter entry and prioritization together with coordinated entry and diversion strategies. So we know that a lot of you have coordinated entry and your shelter is not maybe connected to that process, or you're not taking intakes or enrollments through coordinated entry, or you might be getting referrals from coordinated entry. So we kind of understand that many shelters are kind of in the position where they are participating, but they're not necessarily taking enrollments from coordinated entry. And shelters are therefore critical in implementing diversion strategies. So if you don't have coordinated entry kind of sending people over to your shelter, then it's really shelters that are going to be able to implement those diversion strategies, as it serves as the front door of the homeless response system. Many people are coming to you first. So shelters have this incredible opportunity to engage households and assist them in solving their immediate housing crisis before they become homeless. Shelters, however, again, are not denying service when people are employing diversion strategies. Instead, they are providing a chance to avoid the trauma and the stress of homelessness and a shelter stay and help them find safe and an appropriate alternative. And in employing diversion strategies, shelters have to sort of ensure resources are dedicated to those who will need them most. So when you integrate diversion, you are moving away from the types of questions here that we have in this chart on the left. You are kind of rethinking how you approach people who are seeking your help, and you're sort of reframing how you're talking to them and how you're discussing their options. So you might start now by saying, are you willing to enter shelter? What you're going to want to do is move towards, is the place you are staying safe? What can we do to help you remain there? What can we do to help you and find a safe place other than shelter? You may now be asking, what programs are you eligible for, and who has a bed, and how can we kind of enroll you in a shelter? And what you'd want to move towards as a system is what would resolve your current housing crisis. You know, sort of really make the person a partner in figuring out some creative solutions to what their crisis is. We know that often we want to kind of give people what's available and what we kind of have in our toolkit. Okay, we have shelters for you, we have these interventions, we have assessment, but perhaps you really want to move to just kind of, instead of just offering the bed, talking about what would resolve a person's current housing crisis. Instead of beginning with eligibility determinations, you want to begin with brainstorming, structured problem-solving conversations about a household situation. And instead of beginning with screening and assessment, you want to move to sort of supporting crisis resolution. We'll talk a lot more about this in the second half of this webinar. And with that, I'm going to hand it to Felicia Harrington, and she is the Executive Director of LAMP, and she's going to tell us about how she has started to do diversion practice in her shelter. Thank you, Felicia.
Thank you, Cynthia. Well, Lowndes Associated Ministries to People, also known as LAMP, is an emergency shelter located in Valdosta, Georgia, in a rural community located along the Florida border. We have a population of about 110,000 people. We are the only homeless shelter within a 286-mile radius that serves men, women, and families. Our ESG program consists of 45 beds divided into 4 dormitile-style rooms, 15 beds for single men, and 22 beds for single women. Our family dorms are congregated and able to accommodate 28 family members regardless of composition. That's just a brief overview of what our shelter is like. We also provide supportive services in our day center. We have outreach services as well as on-site rapid rehousing and homeless prevention services. Next slide. So why did we start diversion in the first place? Well, it's cost effective. Diversion is a common sense and cost-effective strategy that helps families identify immediate options for housing without relying on the homeless shelter. Our mission at LAMP is to provide emergency shelter and supportive services to the most vulnerable in our community that have no other options. And we started practicing the method of diversion to help find alternate housing arrangements and avoid a shelter stay whenever possible. And that ultimately frees up space for those who really need it. Next slide. How did we start diversion? Well, I realized that our beds were being more used than not as one-night stays, and in some cases we learned after the fact of a resident coming into the shelter because of an argument or something like that with a family member or friend. So the first thing that I did was develop a plan to ensure that we weren't filling beds with people who had other housing options. The plan was to be more intentional in our question during the initial housing conversation. We were going to ask open-ended questions that could help identify other non-shelter options and help that person identify their own strengths and abilities in order to secure immediate housing on their own. Now, I had to get the board on staff and train them how to effectively divert. And we know that change can be difficult to implement in an environment that hasn't seen policy change in several years. And this typically because people become accustomed to the process that dictate their day-to-day experiences, and more plainly, they just get comfortable. So to get them on board, I first told them why we were diverting people from the shelter in the first place. I educated them on the process of diversion and the importance of it, and how it impacts our organization and the goals and objectives of diversion. It's very important to be transparent and encourage feedback. People want to put their 2 cents in, and a lot of times they have really great, valuable information that you can use in the diversion process. And altogether, these insights gave the staff a better awareness of the organization's vision, ultimately settling any apprehensions about the service we would provide. And as a result, staff trained in diversion started to engage with families right from the start. They helped them to find housing within their own resources, and those resources could be Facebook to connect with a distant relative, their church. We've even contacted landlords and discussed resolutions to get individuals back into housing. And that's why collaboration with other strong social service partners has proven to be extremely resourceful for us.
Felicia, this is Christy. I'm just going to stop for 1 second because I think I don't want attendees to be particularly frustrated. I just need to go in and take the timings off of the slides so that they don't advance on their own. So I'm just going to take a minute to do that. That way folks don't keep experiencing my shifting back and forth between the slides. So just give me 1 second. Okay, great. I think you want to advance to the next slide. There you go.
Okay, so we should be on the slide of when and what questions to ask. There we go, right there. So the big question is when and what questions to ask. As far as when, diversion happens during the initial housing conversation. The receptionist can divert, the case manager, the house managers, anyone in your organization can provide this service, but you need to be intentional in your questions. As you can see listed on this slide, there are a few examples of some open-ended questions that you can ask to kind of get the ball rolling. But I highly suggest that you word these questions in a way that's easy for them to understand and don't sound so rehearsed. You want to sound like you're trying to really solve their problem, not like you're reading from a script. And it does take a little bit of practice. Okay, let's see. For example, Jane Doe calls your shelter and she says, I don't have anywhere to go. I need to come to your shelter. Your response, Jane, talk to me. Tell me what's going on. Where did you stay last night? She says, I was with my aunt. I was at my aunt's house and we got in an argument and I left. Then that's the opportunity right there to mediate. You can save that shelter bed. So you say to Jane, well, do you mind if I ask what the argument was about? Maybe I can help you work it out. And then you just go from there. Just take your time to develop open-ended questions that you can find, so that you can find other housing options that are safe. And a safe housing option would be somewhere that they're not in fear of their life. Next slide. What are we doing to divert people? We are making pragmatic shifts to divert people. As you can see from the previous slide, conflict mediation is your bread and butter. We are problem solvers first and foremost. During that initial housing conversation, we are discussing ways in which we can help people stay out of the shelter, because too often, once they get into the shelter, there's less urgency on their part to try to find something else to solve their issues. And so in addition to conservative methods of diversion, such as conflict mediation, connection to mainstream services and housing location, we have been fortunate enough to be awarded the Homeless Prevention Grant, which has been a game changer in our diversion service. There are many instances where individuals want to come into the shelter because their water, gas, or electricity is disconnected. As we are providing diversion services, we refer them to our prevention program, which will pay to get their services reinstated without them having to come into the shelter. And I understand that not all shelters have the prevention program, so establishing connections with your community partners is key. And there's also a website where you can search for places nationwide that will help pay utility bills. And that website is www.needhelppayingbills.com. It's a great resource to have if you're looking for other resources to help those individuals, and you can keep them out of the shelter that way. Next slide, please. Who to divert with? First and foremost, build on the individual's natural and community support. Their natural support being extended family members, even distant relatives, friends, church members. You would be surprised at how many people would help if only they were aware of that person's situation. It happens all of the time. Community support could be your local United Way, churches, behavioral health services, DFACs. We've even received assistance from the school system and other similar nonprofits. LAMP works a great deal with a nonprofit in our community called Project Hope, and we use them to get bus tickets, temporary hotel stays, food, etc. Use those resources that are available to you. Next slide. So the results of diversion. Since we have been providing diversion services, we have been able to prevent households that have alternate housing options from entering the homeless system. We have been able to keep our beds reserved for the most vulnerable individuals who have no other options available to them. We formulated a spreadsheet that you can see that tracks the calls that we receive. And 34 people called about rental assistance. And this is, you can see the dates on here. It's about a month long. 34 people called about rental and utility assistance, 6 for transportation, and 42 for housing. 100% of those individuals that called for housing due to utility disconnection, we were able to divert all of them. And roughly about 64% of the ones for housing. But like I said, a lot of people that are calling for utility assistance is because of disconnection. So that's when that website is really going to be helpful for you if you don't have that prevention service located in your area. A lot of people just need that service. Diversion does take more time in the beginning because the staff is now working harder to find alternate housing solutions straight from the start. But it does save time and money in the long run. Our front desk person, our receptionist, is usually the first point of contact, and she's the one that takes on the bulk of these diversion cases. And then she would shift it on to our case managers that would give extended services. But tracking this information, similar to how I've done it this way, it will help you to see what areas of services are needed the most, and then you can create your diversion method accordingly. Thank you. And that's all I have.
Thanks, Felicia. Appreciate you sharing that experience. And Kay, I think it's your turn.
So, hi everybody. I'm really happy to be on the call. What our intent was to really start digging into these fundamentals of effective diversion practice. And as Felicia was talking, I'm sitting here going, okay, that's what I was going to say. That's what I was going to say. And by the way, Felicia did not know what I was going to say. So I think the really cool part in this is by having a shelter that has actually made diversion a key component of what they do, and hearing the kinds of things she's saying that just again resonate with us when we talk about these are the fundamental strategies that we've learned really work in diversion. Hearing those two come together is so helpful. So next slide. So we call these the 4 fundamental C's: the community-wide buy-in, problem-solving conversation, creating connections, and continuous practice. And it helps us, internally when we thought of the different C's. But as we talk to people, and the way we looked at this is the more we talk to people that were doing diversion from shelter, like, talking to people, connecting with people before they ever entered the shelter system, when those folks were calling thinking they had no alternatives but shelter, we learned that these were the messages were being resonated. So let's start with the community buy-in. Next slide. So it's really, really super important that you obtain both community-wide buy-in, but also your shelter staff buy-in. This is a huge shift from the way we've often thought about shelter. So I don't know about you, but I know that back in the day when I was, working in the field of providing shelter, is that we were often paid by keeping our beds filled. So my messaging always to my staff was, I was always looking at capacity. The funders were asking me about capacity, and I was always like, fill the beds. Do we have any intakes this week? And so as we start to think about diversion, that is a huge paradigm shift from the way we've often thought about bringing people into our shelters. It's, the idea that an empty shelter bed is a good thing if you don't have people that are living and sleeping on your streets because they have no other alternative. People staying in their cars, people staying in bridges, under bridges. So it's just really, really important that we get this message out and really get the buy-in. So you want to really start with your shelter staff, and it's not just your frontline staff, it's literally everybody at all levels of the shelter. This is going to take a lot of time to really think about what this means and how it's going to change the way you operate. And then over and above that is the community-wide buy-in. This is for funders. This is for anybody that your shelter interacts with and across your system. How do we make sure that there is this buy-in? So on this list, we've really given you a sense of how to, the who and the why of the community-wide buy-in. So I talked already about the shelter staff, but I also want to say, in addition to staff, really think about your board of directors. We found that sometimes in all of these shifts that we talk about is that it's been really hard for some shelters to provide these new ideas and get their boards to buy in, because a lot of times board members have perhaps been on the board since the beginning of a shelter, and this is such a change. And then that thing about, making sure we keep our shelters at capacity and not turning anyone away, and a lot of that messaging that we've been out there, especially when we've been trying to raise money. It's going to be really important for your board to really get this and understand this, but also your funders, the people that give you the dollars, the people that you're talking to. We know that for most emergency shelters, you depend on your donors, and your donors really need to understand that this is not something bad that you're doing, but this is really a good thing, and it may be even a way to think about, how do we fund some of this stuff that we talked about, and how do we think about that? You just want to make sure that diversion is fully integrated, into everything you do at the shelter, that it's not like this separate piece, this separate program, but rather it's a fundamental part of your whole system, and it starts at that very front door before anybody ever comes into shelter. So just making sure that there's a clear message about what diversion is and the role it plays in the system, and then the role that shelter can play in it. The role shelter plays in diversion, and Cynthia already talked about this, is that, if you've got coordinated entry before a shelter bed, that's where diversion can happen. But even if you have that, we would suggest, and what we've learned is that even between that point where that first diversion conversation happens at the coordinated entry, and then the time that people come to the shelter, is that we still are telling shelters, don't immediately start doing an intake. You need to still have that conversation, because it might be that something, has triggered in someone's thoughts, and having a next conversation. Even if you've got coordinated entry, shelters should not be doing diversion if they're like the point of entry into the homeless system, but it should happen even if there's the point of entry before the shelter and that point of entry has referred that person to you. I want to also emphasize the very last bullet on this slide is that there has to be ongoing training on diversion strategies, and this is not like a one-time thing and we're going to just talk about diversion. But it's an ongoing thing, because people change and we keep learning more, and you just need to keep this as an ongoing fluid message. So again, just realizing that, yes, we're talking to you guys as shelters and how important this is for you, but this is also a community message. So as you start looking at integrating this into your shelter, really be talking about your system leadership and all of these other folks as well, because that message is going to be important. Next slide. So as I said, you want to keep that training and that conversation going about the messaging. So let's talk about this problem-solving conversation. In some ways, when we started really talking to folks that were doing shelter diversion, we just really heard this one thing, and people talked about that it really is about conversation, and that is just so critical. A lot of times people thought it meant about getting a funding source or setting up some type of program, and we heard again and again, even from communities that initially started that way, is that they wish they had not done it that way, because it really needed to be an integrated conversation into what we did. So it's not a magic bullet, but rather every individual will have a unique problem-solving conversation that looks at their own individual circumstances. It's all about problem solving. So I think, how does this sort of work for shelters? So, and I already said this, but even if you've got those diversion conversations happening at coordinated entry prior to shelter referral, I just want to emphasize again that you really need to think about how incorporating diversion will shift you from how you currently take referrals and how you currently bring people into the shelter. So remember, I said this, and I'm going to emphasize again, even if you've got beds or available space, you still have a process, and sort of, I talk about it, it's a timeout. Before you do an intake, however you're doing intake now, timeout. We don't start the intake when that household, that person shows up at our shelter. Maybe you're doing intakes by initial phone calls. Before anything happens, we need to have these conversations. So it really is critical that whoever is that front point of contact has this understanding of how diversion is going to work in your shelter, and you really need to have your trained staff and really be thinking about your staff trained. I said that around, your training staff. You really need to have your staff trained, and you really need to help think across your system. How do we start these conversations? What's our environment going to look like? How are we going to make sure that we've got this private setting so that a conversation can take place? So this is not about a score, and if people, are assessed and have a score, then we're going to have the conversation. It's not about a list of questions. Well, if they answer it this way, then we go here and we do this. This is literally about a one-on-one conversation that, like, if I'd come to you as a friend because I have this problem and I just need to talk it out and think about what I can do, that's the kind of conversation we're talking about. So again, part of the conversation also might be that you want to have your shelter staff share the realities of shelter life. Sometimes what can happen is in our system, there can be this misconception in many cases that if I can get into shelter, then I am going to get a resource. I think particularly as we've done some coordinated entry and we're starting to really look at how people get referred to rapid housing or permanent supportive housing, there's sort of this sense, and we've heard this when we've been out in the community, is that people think that they can't, that if they come into shelter, then they're automatically going to get in one of these, I like call them the buckets, like I'm going to get rapid housing if I come into shelter and get that service, or I'm going to get permanent supportive housing, or I'm going to get some kind of subsidy. So I think it's really important that that part of the conversation is also to be very clear is that this is not the place that you're going to get those things, that that's not an automatic given that you come in and you get those resources. And really, I heard one shelter that said and this was a community that actually had diversion at coordinated entry. And so their initial thought was, well, we don't need to think about this. But then when we talked about this, what they started doing is before they did any kind of intake, they just took a tour of the shelter. When people came in and said, well, we just want to tell you about our shelter and this is what it is. And then they'd sit down and say, so do you have any questions? Have you, like, how did you get here and what made you think, you needed shelter? And I don't know the exact words they said, but they found that, all of a sudden about, they used the term, and I don't know if they had data, but like 1 out of 10 people, even after they'd gone through all the diversion conversation, decided not to come into the shelter. So you want to have these realistic discussions and really help your household think of creative solutions. So it's all about all kinds of stuff. It can be about employment. It can be about transportation. It can be about food security. And Felicia said this so succinctly, like, what are the kinds of supports they've used? Who are they already connected with in the community, and making sure that those connections happen? So really that last bullet on this slide, really discover what other options might be available and help them identify those current supports. Next slide. So this actually came from our friend Ed Boyd. He formerly worked with Cleveland Mediation Center, and I asked him if we could use this slide, and he said go right ahead because he had used some of our information in his stuff. But this is so important. I think the most important thing I want to talk about, that a conversation is about listening and validating a person's experience, really believing that they have the ability to solve their own issues and their own problems and help them articulate their needs. It's not about us thinking that we know what's best, or looking at somebody and go, oh, this is like, this is really bad. And the solution they choose may not be something that we would choose, but that doesn't mean that it's not going to work for them. And we just have to be really careful in our conversations to allow them to make their own choices. I think consistency and building that support and trust is incredibly important. And I'm going to talk a little bit about that when I get to the third C. Next slide. So this is, this is something that has been shared with us. So an example that was given was somebody that had shared with us a little bit about how they work with folks, because what shelters often find is that people are often not coming from their own housing, but often are coming, they've maybe lost that housing, they've been evicted from that housing, but they're not calling for the shelter. Sometimes it's been maybe a year or two that they've been living with somebody, or maybe they've even moved a couple of times between some family members, or sometimes people come to us at shelter and they've always lived in a shared housing with a family member, but something breaks down and they end up on the shelter door. So the conversation about how can we make those situations more manageable. So it can be things like, and this is the kind of things that you guys can be thinking about, like what are some resources we could do to make this more manageable? Maybe it's about how that person can contribute to household supplies and food. Perhaps it's ways that they could help ease the burden on the household they're staying with. And this is just the kinds of things that have come up in conversations. And often it's between the two parties, like getting that party on the phone and having a conversation among the parties to find out sort of what made that breakdown and what could make it better. And so it's really about engaging. And I want to share that we heard from one shelter one time that said to us that they had all of these resources, like you came to the shelter, and this was a shelter for families, and they made their own food. They cooked their own food, and so they had this whole food bank, and then they had a clothing bank, and they had the laundry detergent and all the personal items, and they realized that they had all of that stuff that they could offer at the front door, because sometimes just those kinds of things could help somebody stay where they were. So really thinking strategically about what are the things that we already have and the things that, opportunities that we offer the shelter, that people shouldn't have to come into shelter to get those things if they can stay where they are. Next slide. So we're going to head into the third C, and that is creating connections. So a lot of times we think about these connections as being all of those community supports. And again, you had a great list from Felicia, so I'm not going to go into much more detail about that, other than saying, as Felicia, shelters can't do it all. And it's really important to think about who are some of those partners that you have already worked with, but your partnerships have been how they can assist with people that are already in the shelter. So reaching out to those partners and letting them know that you're shifting your work to not just look at people in the shelter, but people that are out of the shelter. It might mean that those community connections that you need to really be thinking about how they can help somebody stay out of shelter, which might be different in their relationship with you than what they've done with your clients when they're in shelter, but really calling those folks, connecting with those folks. And I think the warm handoff thing is just so important. And this is not just for your community connections, but all those natural supports, those connections that people have. It is just so critical that people have their own supports. And sometimes when you're in a housing crisis, you're in crisis mode. You're only thinking with that part of your brain that deals in the short-term crisis, and you're not thinking about supports that you may have had in the past, people that have helped you in the past that you can connect with. Felicia talked about it. It could be a church, and that's more than willing to help. They just don't know what's going on. So just making sure that we don't get into that. This has to be connecting to mainstream community connections, but all those other types of supports that folks have. Next slide. So I think it's just really important to realize that, every different connection is going to have a different response and a different role, because all of these conversations and the plans are individualized. There will never be a package that a diversion conversation leaves somebody with. It is literally creative and unique to each household. So it's going to be so important that when you connect with family and friends or a provider, explain clearly who you are and what your goal is. And so, and this tips for creating connections also goes into the warm handoff. So go to that slide, Christy. Well, this is all those different ones. So we'll go. So these are the different places. I think we've talked about this. We've already seen this with what Felicia talked about. So it's this warm handoff. So you really want to, when you're making those connections, you really want to make sure that the person you're connecting with knows why you're connecting with them. But the more you can have that person be involved in that conversation, like if you're picking up the phone, put the person on speakerphone so it is a joint conversation. This is not about, you calling and just talking to somebody, but you want to involve the person. It is really important that the household that's presenting for shelter that you're working with here's what's being said, and you really want them to be involved in the conversation. You're just to facilitate it, and that's where the mediation comes into play. Again, repeating what Felicia said, is that mediation is critical, and so the role that you often play is a mediation if it's with a support system, and it often is maybe mediation with a mainstream support that somebody has worked with that might be able to come back on board if perhaps somebody had been disconnected from that service. So it just really making sure that everyone is an active member in problem solving. And this is information, by the way, that we have taken from looking at other resources in communities from the health system, the medical system, that really talks about why warm handoffs are important. And we just adapted it to this because we just want to make sure that when we're doing the diversion and have these conversations, it's not just saying, oh, that's your plan, okay, see you. It's about making a warm connection. Next slide. So the last one is this continuous practice. And that's just to say this is not a once and done intervention. So the problem conversation, the problem solving conversation may need to happen more than once. It's just also really important that if a household is diverted, there should be some kind of plan for follow-up, that it's not like somebody just leaves and there's no follow-up. You may be the person that is doing follow-up. It might be another community provider that you've given a warm handoff to, that there's a plan for follow-up. But again, it's just not a once and done. It can happen a couple of times. Every situation is going to be unique. But I think it's really, really important to remember that maybe somebody has been diverted and, a month later they come back. And we don't want you to think of that as a failure. Reality is that household, for a month was not homeless. They were out of the homeless system. And in addition to that, there might be another solution. That situation might be able to be resolved again, or it might be that we can come up with another solution. So it's not, again, a checklist. This is this ongoing process. It's ongoing conversations. And it's the stuff that we, as social service people, have always done. And, our work is about problem solving. And so when you really think about those key fundamentals, it really takes us back to our roots in social service. So as we start really thinking about how do we know that this has worked or not worked. Next slide. It's going to be really important not to have everybody in one bucket. So Christy's just going to click a few times and you're going to see like 4 things show up here. These are the kinds of things that are successes, but none of these will look the same. Permanently back with friends or family. Well, somebody says to me, what's permanent? There's no definition of permanent. If a family or friend says, yeah, they can come stay with me, that's a success. Now, if somebody says, well, they can stay here for a day, well, then you want to make sure that you're reconnecting and finding out, because sometimes you'll resolve something for that night, but then you set up another time that person can connect with you or someone else for a longer resolution. But there's no definition of what does permanent mean. It is that you can stay here and we're not going to give you a short time limit on it. But how that works and who it works and what the supports are around making that work are going to look different for every household. It's really most important to remember that what success means is that someone is in a safe alternative to shelter. They have not come into shelter. That is ultimately how you measure success. And I think, again, back to what Felicia said, is that this is just a day-by-day process, is that from one day to the next, you don't know when it's going to be. So as shelters, I'm just going to encourage you to, after you hear this and you step back, start really looking at your job descriptions. Are your intake people, the current people that do intake, diversion strategies, they should know that their job is about diverting. So it might be looking at job descriptions, looking at your policies and procedures, looking at your space. Do we have the kind of space that these conversations can happen in that's private and comfortable and allows the time, because this can't be a rushed thing. It is literally it might be, an hour and a half of throwing things around, and the next time it might be 15 minutes because it's individualized. So with that lens of what it would mean, what does it mean for us to do diversion, start really thinking about your space, your staffing, the community buy-in, getting people on board, and the training that you're going to need to make this happen. So I'm going to turn this back over to Christy for Q&A. We have about 25 minutes left for your questions. So Christy, it's for you.
Great. Thanks, Kay. Thanks, Cynthia and Felicia, for that presentation. We have had some really great questions come in. So I want to start with, let's see, I have a couple here lined up. So this is from an attendee who said, part of the difficulty I have found is that there is no way for folks to get rental assistance without entering the homeless system, which begins with shelter. If someone can't afford market rent rates, they have to wait for public housing or Section 8, which takes sometimes over 2 years. So any thoughts, panelists, to that question? And how does diversion, if the only way to access homeless services or housing and support services is through shelter, how does diversion impact that within a system?
I can start. This is Cynthia, and I'd love to hear what the other panelists have to say. I think this is one of the issues with putting all of financial assistance within the homeless services system. So people feel like they have to enter the system or enter a shelter to even get help. And so the idea really behind diversion is to kind of put some of that assistance outside of the homeless services system. Yes, it means that you would have to look at your funding a little bit differently. So you might need to find flexible funds. For example, you can use your ESG dollars that you might get, some of which might go to rental assistance, the rapid rehousing portion, but that prevention assistance that's outlined in ESG funds can be used for diversion services, and you can be using that before someone gets into shelter. So, for example, some communities like Massachusetts have said, okay, instead of coming into shelter, we will give you help. We will give you financial assistance and other kinds of services, and you don't have to enter shelter. Now, the issue, of course, is if you have everything inside shelter and people feel like they don't have any other alternatives, what you want to have inside your shelter is not just financial assistance, but also a lot of kind of housing-focused services, case management, trying to help people kind of figure out how to build up the kinds of funds, the kinds of income, maybe figure out a shared housing situation so they're not sitting in shelter and languishing in shelter, waiting for public housing or Section 8. And we have kind of a whole set of strategies around what those housing-focused services look like in shelter. But you kind of want to strategize so that you have some of your financial assistance outside of shelter, and then figure out how to make sure that people have other types of housing-focused services in shelter that are not just waiting for a Section 8 voucher. Kay or Felicia, I'm sure you have some things you might want to add.
So this is Kay. I think I'm going to, in addition to reiterating what Cynthia said, I'm also going to say most communities, don't even have, the waiting list is so long, and even when communities have a homeless preference, it might be that, there's only a small percentage of, public housing or vouchers can become available. And so, I know the question said 2 years, but I know most communities it would be, 10 years till somebody ever had the ability to get that. And so somebody can't, languish in shelter because now, you're unsheltered folks, your shelters can only handle so much, and then it just keeps growing. There's no system flow. So I think, again, it's that reality is that you want to make sure that coming into shelter should not necessarily automatically push your name up higher on a list. And that if you do have the homeless preferences, it's something that you're doing internally within your system, but you're also looking more at the by name list. Who's the most vulnerable person? Who's that person? Not the first come first serve, but or the person that's been waiting the longest, but literally who is the most vulnerable? Who's that person that's just has the most barriers, and being really active around that. So I think, and I think that's really a system issue. This is where this community buy-in has to come in, and that we really need to have good system discussions if in fact getting into shelter means that suddenly you're going to get a bunch of stuff that people not coming into shelter and not willing to call shelter wouldn't get. So it is a paradigm shift that you really need to be thinking about in your communities if that's in fact what's happening. And Felicia, I don't know, because I don't know if you have that for a priority or not in your community.
And, I'm just really piggybacking off of what you and Cynthia said. We're going to always have those problems as well, but we really try to navigate through them by, like you said, really sticking to the most vulnerable and really utilizing that rapid rehousing program to kind of just pick up the slack in that area. We haven't had as many problems. Our waiting list isn't as long, and we work really closely with the housing here that will get people in housing quicker if they are homeless. But then you'll have that problem again of them coming into the shelter. But they don't necessarily have to come into our shelter to get put at the top of that list for the housing authority here in our area. So it's really about the collaboration that you have with your community resources, because if just giving them a document saying that this person came to you seeking homeless services, maybe that will suffice for getting them closer to housing that way. So really just opening up that communication with them can help out a lot.
Great. Thank you all. The second question is from Melissa. Her question is, in domestic violence shelters, we take clients who have no choice but to leave their unsafe home and come into shelter. How do we help most effectively with diversion once they get to our shelter so that homelessness does not continue after our program's completed, which is about 45 days?
This is Felicia. Now, we are not a DV shelter. However, we work very closely with the DV shelter that's in our area. And basically, the same thing that you're going to do in that situation is housing first. As soon as they get into the shelter, you're going to identify their strengths and their weaknesses, just like you would if they were someone else that's not experiencing domestic violence issues. You're going to try to get them into housing. If they have a job already, use those 45 days to help save up that money so that they can secure housing. And also, it's going to go back to coordinating with your community partners. If they have a rapid rehousing program in that area, put them in rapid rehousing so that they can be self-sufficient and not rely on their once head of household to depend on them for that housing solution. That way they can do everything on their own. So really stick back to that housing first and focus on getting them established on their own so they don't have to be self-reliant on someone else.
Yeah, and I think it would be the diversion. I mean, again, we said safe alternatives. So we've learned, that for some DV shelters is that they are having the conversations because, they're coming in, they're in a crisis, but those conversations might be that maybe there's somebody that's out of the area that we can, get them, get some bus tickets or get some transportation to connect them with, the reason they're at the shelters, they have no way to get to a family or support system that's not in the area, but they would have a safe alternative to shelter that would keep them safe. And so the diversion is about helping them get to that safe alternative because it's going to be so much less traumatic for kids to be, for the children in a family as well as the mama or the dad to, connect with people that they already are comfortable with than coming into shelter. So it's that safe alternative. So always that safety thing, but realizing that when somebody comes to shelter, there may be another option. They just don't have the ability or haven't even thought through because they're in crisis. So taking that time out, spending that time when they first show up at your door to think about where would they feel safe and secure that you can help them connect to.
Okay, that's a good segue into the next question, which there have been a couple similar questions or kind of related questions. So can the three of you tell us about what the research and data has said about diversion strategies as an effective strategy for, I think, both a system. So one of the questions is, I think attendees do understand kind of the benefits of diversion on system effectiveness, reducing first-time homelessness and cutting down on shelter wait lists and things like that. But there's some interest in looking at, is there any research or data to demonstrate that outcomes are better if people are diverted instead of returning to shelter?
This is Cynthia. I think that we, because this is, well, some communities have been doing this. I think shelters often have been doing diversion strategies, maybe informally, not even calling it diversion for a long time. They weren't necessarily documenting how it was working, although some have. What we found is that there's a lot of, that now as communities are sort of embarking on this, and some communities are further along in this, they're starting to actually track their data. So, for example, Connecticut, and this is through the Connecticut Coalition to End Homelessness, has started employing diversion strategies, and I think they started doing this about 2 years ago, and they started looking at whether families or individuals were returning, when they would return, what kind of services they wanted, and their numbers of who they were diverting and who was coming back made it seem like it was a very effective strategy. Where diverting a significant amount of families and individuals, and then a much smaller percentage were returning at least to the homeless system or to the shelters, and so and then you can find that diversion, some of their local level data right on their website at cceh.org. Other communities are also tracking this, and Building Changes in Seattle is another community sort of look at the data that's out there in their local community and how it's working. So I think the research that is underway has mostly been about prevention, and some of the studies that have looked at prevention and prevention's impact on homeless systems has showed that prevention overall doesn't really have a huge impact in reducing people's homelessness or the sort of number of homeless people in a community. It's kind of hard to track that. So I would say that diversion right now is happening. Community data collection is happening at the local level. What we're hearing is and seeing is that communities are diverting people and trying to track to see whether they come back to their coordinated entry systems and whether they're coming back to shelter, and that kind of is underway. And that's where we're really kind of hearing more about the successful strategies.
And the only other thing I'd add to that is that what we also do is we have data on, AHAR data on exits from shelter. We've also done, when we look at individual communities, we look at this all the time. And gosh, I don't have the number right in front of me now. So Cynthia, you can jump in if you know it. But I think on the single side, it's like less than 20% or around 20, only about 20% exit from shelter to a permanent housing destination. And families is higher than that, but it's still under 50%. So what we do know is even when people do come into shelters, that doesn't, the positive exits are not very high. And even out of those positive exits, there's still returns to shelter. So, and we also know that there's a high percentage of people that come into shelter and leave within a short period of time, 1 to 2 weeks, and never enter the shelter system again. So that, and while we may not always know where those folks go, we have some shelters, again, up in Connecticut. We're doing some work there now that are actually, have found ways to track those people that are leaving and are finding out that the majority of them that are leaving, they've actually started asking for cell phone numbers as soon as somebody comes into a bed, and they're finding that the majority of those, and this is on the single side, are actually in a permanent housing situation. They've self-resolved. They came into shelter and then they ended up like going, okay, this is not working for me. Maybe I can try something else. So it just again reiterates why those diversion conversations are really important.
Great, thank you. The next question I have is about, so I think this is maybe a clarifying question in terms of I'm sorry, what do I want to say about literal homelessness, being literally homeless, and being precariously housed, and doubling up. So I think a clarifying question, Kay, to your comment that that measuring success is not being in shelter. So I think the person with the question has an understanding that homelessness may include couch surfing and not the HUD definition of homelessness. And so I know that there are some other federal agencies that do follow a different definition of homelessness, but I just think it's important for you all to make clear again that where we're talking about diversion taking place and how that affects shelter and would be tracked within system effectiveness does not include a doubled up couch surfing situation. This is somebody who is presenting for shelter. So I'm just wondering if you can, one of you can just clarify again what we're talking about in terms of that moment of diversion.
Right. So we're talking when somebody is actually coming asking for a shelter bed, that the doubled up situation they're in, or the couch surfing they've been doing, they have no more couches to go to, or their doubled up situation has fallen apart and that household is saying you can't sleep here tonight. We're talking that day the household is presenting. So that's what we mean literally homeless, and that's where diversion happens. So we're not looking at the other definitions of homelessness that are further up, that look at doubled up situations, and looks at folks that are living with other folks, because in fact, we know that in a lot of communities, people, because it's so expensive for housing, that people are choosing roommate and shared housing situations. And so we're not, talking about that. What we're talking about is that person literally is at the door of shelter asking for a bed to sleep in that night because there is no other alternative for them. There's not another person for them to stay with. There's not another couch that they can go to. We're at that literal point when we're talking about this.
And I think
Cynthia?
I think the way to think about it is when you're trying to figure out like who is going to be the right people to divert, you're really trying it, as I said, with everybody. So whether that person is doubled up or is on a couch right now, and as Kay said, maybe that situation is starting to fall apart. I think that the place, it's the when kind of when it happens. So they're asking for shelter, as Kay put it, and they may be able to stay in their doubled up situation, right? They may be able to go back to couch surfing if they're staying with their brother on their couch, but things have gotten kind of tense because they're eating all the food in the house. And so maybe with, help with some food assistance or a little bit of money, they can stay with their brother still. And so, it's because by the time that you're helping people avoid a homeless episode and a shelter stay. And so you want to be able to figure out what that person needs to kind of either find some sort of alternative, even if it's for a few days. And so it's really about kind of the when it happens. In this case, that it's when people are saying, I think I need shelter. And you're saying, okay, are you absolutely sure? I know it feels like you don't have any alternatives, but let's really sit down and think about ways that we could fix your current situation.
Great. Thank you for that clarification. So we just have a little less than 10 minutes left. I have a couple more questions that have come up. So can you all give some guidance on if whether or not you're going to use financial assistance as a part of your diversion strategies? You may even be looking for funds to pay the staff of the folks who are going to have the problem solving conversation and kind of be that front door person to begin the diversion strategy implementation. So can you talk a little bit about where communities get their funding to do diversion, to pay for staff and or financial assistance?
This is Felicia. Currently, we do not receive any funding to do our diversion. It's just a conversation that we're having during the initial conversation piece with anyone that's calling looking for services. So it's nothing strenuous that we have to do on our part. So this is something that our front desk can handle on their own. It's just time consuming as far as asking a little bit more questions, maybe trying to problem solve, and it's as simple as passing on that information to the case manager and letting her do her job that way. And it hasn't really put anything extra on her plate because there are times that we have downtime in our organization where she can allow her time to follow up and utilize interns. In Valdosta, we have Valdosta State University. They're a great resource to us. We have a lot of students that come here to do their internship. So using marriage and family therapists have been a great resource for us. We also have the technical college, and you have seniors that are wanting to volunteer their time. So you can use those resources as well instead of trying to pay someone else to do those diversion services. We pinch pennies wherever we can because we are a nonprofit, so we're always trying to save money in some areas, and that's the best way that we can do it for now.
Felicia, can I ask you a follow-up question to that? I think
Sure.
it's related in terms of funding. So one of the shelters asked, we have to, I understand that we should not treat diversion as a separate program, but we have to track and account for all of the services that are provided from the shelter. And even though the person may not be, we may end up diverting them from shelter, how do we account for the diversion services that we're providing? I don't know if that completely makes sense.
It does, because my HMIS specialist asked the same question. She's like, we should get points for that, So unfortunately in HMIS, you cannot track it that way, or that I know of, that I'm aware of. So what we do is use that sheet that we've seen on that PowerPoint, and we track it that way. And we're part of the Homeless Coalition here, and we all turn in our results at the end of the month to see how we diverted and put it all together that way. That's the only tracking that we have at this time. Now, I'm not the subject matter expert in HMIS, but if there is a tracking system, I would love to know about it as well. But as of right now, there is no way that I know of how to track it at HMIS. We just do it separately in our own database, which is Excel.
Great, thank you. I think we at the Alliance here, we can probably put up some resources or examples of communities that actually are using HMIS to track the diversion activities and strategies that they're doing. So I think that's a follow-up item we can also provide. I don't have, I'm going to transition on to a few more slides, but if Kay or Cynthia or Felicia have any last words for us.
The only thing I would add is just, within looking, when it comes to, so we, Felicia talked about the staffing piece and how you make that work. But I think then, and I agree, most shelters that have done this is that they have not added necessarily additional staff. It's just changing the responsibilities, because sometimes just the paperwork trail and taking everybody through all the policies and procedures and, all that kind of stuff can be time consuming as well. And so that, they're finding that just by changing job descriptions and getting, people on board with it, works. But I think in terms of if you want to have some flexible resources, if you need to buy somebody, a bus ticket, maybe it's getting a car fixed, maybe it's, some of the food insecurity, helping, pay for something with somebody you're staying with, and then working out a plan that you could start paying towards it eventually, the household you're working with. So we've seen some shelters that have just started really looking at their budgets and thinking, with learning all this that we've done, do we have to pay for some of these extra services that we've, brought in if we're really going to shift the role of shelter, and just shifting some budget line items around. There's often, sometimes if you've got a grant writer in your organization, sometimes these small grants, there's people that don't want to pay for staffing, but they'll pay for something, right? And so, having some flexible funds can be very useful. So I think we've just learned it's a variety of ways. It's just like we're saying these are, creative problem-solving conversations. Well, finding the funding is a creative problem-solving conversation to figure out how to fund these, flexible resources that you want.
Right, and I think adding on to that, I think Cynthia may have shared this overall with folks in the question box, but some shelters who don't have capacity to maybe add this onto their plate have partnered with other organizations to come in and have those conversations. And for example, Ed Boyd out of Cleveland, when he was with Cleveland Mediation Center, Cleveland, they had the mediation experts come in to the shelter and do those problem-solving conversations. I'm sure that there was some sort of MOU, and I'm not exactly sure how the financial part of that was worked out, but there are partners in the community. I was going to say, if you're looking for maybe inexpensive or free training, oftentimes the legal bar, legal aid, and other legal services often do mediation arbitration training, and they might be a great partner for you to get some of that training for your staff, or to even come in and volunteer some of that time and practice for you. So we are coming up on 3:30, and I just want to alert everyone that we are going to have our next Emergency Shelter Learning Series webinar in October. So just next month. We haven't finalized a topic on that. We're in the process of doing that right now. So we hope you will join us in October, and you'll get a link to registration for what that is sometime in the near future. And last, if you have any questions about what you learned today, or just want to touch base about what you've learned, or if you didn't get your question answered here and you're just burning to get it answered, please feel free to email the center at naeh.org, and we will get back to you as quickly as we can. So thank you so much for joining us today. We hope that this presentation has been helpful to you, and thank you again to our presenters. Everybody have a great day.